Kate. I had a really different experience than Alex in the pediatric ER. We were so busy. We were rooming people in the hallway often, and I saw a lot of pathology and really cool cases. This was definitely my favorite. There was a lot of controversy in the hospital about it. So let's go ahead and just get started. So we have a 4-year-old female presenting to the emergency department for sudden onset ataxia. Her mom noticed that morning that she was kind of walking funny, but she was still laughing, wasn't complaining of any pain, so she wouldn't send her off to school. And the school called the mom and was like, your daughter has fallen several times, she can't walk, like you need to come get her, something's wrong. Mom came and picked her up, brought her to the pediatrician. Pediatrician did notice she had ataxia and truncal ataxia, sent her to the emergency department. The patient didn't have any pain. She's never had any episodes like this. The mom denies any recent illness. She currently had a little bit of a runny nose, but her mom attributed that to allergies. No sick symptoms whatsoever, no change in activity, mental status, no exposure to drugs or toxic substances, and no trauma. So we're like, what's going on? Why is she walking so funny? What's happening here? Past medical history, family history, and social history, honestly completely irrelevant in this case. She had none, and nothing really related to the case, so we're just gonna blow by that. Review of systems, as I said, she only had ataxia, and then also a little bit of a runny nose, but everything else was negative. Physical exam. So obviously with this case, we did a pretty thorough physical exam because we didn't know what's going on, and it's concerning when a child can't really walk. Everything was normal, musculoskeletal wise. She didn't have any joint swelling, there was no redness, no pain, normal range of motion, everything was great. Neuro exam, she was alert and oriented, no focal deficits, cranial nerves intact, sensation intact, her strength was still intact, but she did have that ataxia. She also had truncal ataxia, and her reflexes were absent. She had no reflexes. So that was a big red flag for us. You guys can think of some different things that might remind you of, you might think Guillain-Barré. Very common presentation for that. So with that, we're definitely gonna get some baseline labs, some imaging, and a lumbar puncture. Other things on the differential diagnosis, cerebellar ataxia. This can happen post-viral, but she hadn't had any sickness, but she did have that runny nose. We also wouldn't see absent reflexes with this, but still something to consider. You know, maybe our exam wasn't right. The pediatrician didn't mention anything about absent reflexes, but also pediatrician might not have checked. Another thing is tick paralysis. This is very, very rare. But her mom had denied any exposure to ticks. I did have that in the HPI, I don't think I verbally said that, but had denied any exposure to ticks, and we didn't find any ticks on exam, and we did look. Another thing would be a spaced occupying lesion, so a mass in her brain. This onset makes that very unlikely, but we'll definitely go ahead and get brain imaging. While I was there, we had 4 patients that we diagnosed brain tumors in. Yes, in that 6-week period. Very weird. More I can talk about that because there was also some other things going on that were very strange. Lastly, drug exposure toxicity. The mom denied this, but who knows, maybe the kid got into something. Definitely something to still keep on the differential. So moving on to the assessment. We did all those things. Oh, maybe if it'll load on the screen. That's weird. Hold on. It like loaded half of it.
There it goes.
There we go. Okay, so your analysis came back a little abnormal, possible UTI, not very convincing. She just had a little bit of, I think it was her site history sums off, but not super convincing. Everything else normal. Her lumbar puncture was normal except for a little bit decreased glucose. Information here, with Guillain-Barré, you see increased protein. So it didn't really fit that picture. But honestly, all these results didn't give us much information at all. And her RVP came back negative, so she didn't have any current viruses. So we decided to admit her to the floor after consulting with neuro. Neuro also did the exam. They confirmed, yeah, she doesn't have any reflexes. Went ahead and got an MRI. Brain was read normal. MRI of the spine read subtle post-contrast enhancement of cauda equina, which is suspicious for Guillain-Barré. Here are these images here. Personally, I do not see it. I looked up cases where you do see it, and don't see it at all. And I really studied these. I was really interested in this case. Anytime there's a subtle anything on imaging too, I'm also a little bit suspicious. But that's what was found, and her tick titers came back negative. So our initial treatment plan, she's already admitted to the floor. They're gonna start doing IVIG for 5 days, constant neurochecks, and consult PT and OT. IVIG is the treatment for Guillain-Barré. So that's kind of what they were with that. With the MRI findings, that was what they were thinking. So let's talk about her course. She was admitted to the floor. By day 3, her weakness was worsening so much she couldn't even control her head. She was having trouble swallowing, and she had impending respiratory failure. So we admitted her to the PICU. Basically, like right after she was admitted to the PICU, she started desatting down to the 60s. She had an MAP of 42, so of course they intubated her. Once she was intubated, they switched from IVIG to plasmapheresis, so that's plasma exchange, which is another treatment for Guillain-Barré because the IVIG clearly wasn't working. So she was in the PICU. Small little detail, on days 5 and 6, they noticed she had a buttocks wound, so she could go ahead and get some sacral ulcers and develop pneumonia, likely from the intubation. Here I have the pictures of the progression of her buttocks wound. Obviously that was being treated the whole time. Pretty unfortunate that she did develop that. So just another reminder when you're in the hospital, or keep moving your patients around and just be aware of those things. And then here is a right middle lobe pneumonia infusion. Possible, they treated her for it of course, but even they weren't really sure if it was a true pneumonia. So back to her course. On day 11, she's extubated. That's amazing. And here is the big kicker. On day 14, they found a 1.8 centimeter engorged tick on her scalp. And here's that tick. So massive. Yes, that was our response too. She had been in the hospital for 2 weeks at this point. Her grandma had been braiding her hair pretty often, and we find this tick. So there's lots of controversy. Is this Guillain-Barré or is this tick paralysis? So continuing on the timeline, a day after the tick is found, she's moved back from the PICU to the floor. She's doing better, and on day 21, she's discharged. I do have to say, the notes from the providers on the floor, in my opinion, were really bad. They did a really bad job describing her progression and her recovery. I didn't get a whole lot of information from it. They documented, obviously, that the tick was found, but didn't do too much of a deeper dive into what was going on. It was also disappointing to me that for her discharge, they weren't able to say on discharge whether she was going to an inpatient rehab facility or whether she was going home. From one of the notes I read, it sounded like her mom didn't want her to go to the inpatient rehab facility. And this mom was very on top of it. Like, she wanted her child taken care of. Like, for her to say that also kind of made me think she's recovering more than what we think. She doesn't think she needs it. So just something to think about. So I made this little chart here comparing Guillain-Barré and to tick paralysis. So Guillain-Barré, autoimmune attack, classically seen after an infection, classically from Campylobacter. Tick paralysis, so tick paralysis is really, really rare. This is something I don't believe we even learned about from didactic. Tick paralysis, there's only 5 different ticks in the world that can cause it. It's much more common in Australia, very rare in the US. Only a female tick can cause it, and it only happens when the tick is attached. So the tick has to be attached and feeding, and it's releasing a neurotoxin, and that's what causes the ascending weakness. And you can see here the similarity between the both of them is that ascending symmetric weakness, which we definitely saw with this girl. A little bit different is that Guillain-Barré progresses over days to weeks, and usually those symptoms peak around 4 weeks. Clearly this isn't what we saw with our girl. She came in day 1 with just ataxia and was intubated on day 3. So hers was more rapid, which goes along a little bit more with tick paralysis, where it progresses over hours to just a couple of days. Presentation, like I said, they both present with that ascending symmetric weakness. Some things you'll see with Guillain-Barré that you won't see with tick paralysis is you'll also have sensory deficits, so losing feeling, tingling feelings, and another thing that's often overlooked in Guillain-Barré is pain. There's also often this deep, achy pain in the hips, butt, the thighs, the calves, and our child had no pain. Lastly, some autonomic dysfunction. with everything going on, we'd probably see that in both of them anyway, so that's kind of there. So physical exam, kind of what I just said. You'd have those sensory findings with Guillain-Barré, and hopefully with tick paralysis, you would find a tick. Like I said, we did not. Diagnostics, this is where you can really tell the difference between them. So with Guillain-Barré, like I said earlier, you do have elevated protein in that cerebrospinal fluid, which we did not see. MRI of the spine, you can often see this, which with us, I don't know, I personally think the interpreters knew what the presentation was and they were looking for it and maybe tried to convince themselves they saw it. I really looked and did a lot of research, and I do not think that she actually had post-contrast enhancement in her spine. If we did a nerve conduction study, this would have been really telling, because with Guillain-Barré, you have slowed conduction, and with tick paralysis, you don't. Treatment, as I said, Guillain-Barré, IVG with plasmapheresis. Tick paralysis, you just have to remove the tick. Some kids are back to normal within 72 hours. So another reason it was really frustrating that in the notes from the floor, we didn't really have a great description of how her recovery was going. Prognosis, Guillain-Barré can take up to a year until they have a full recovery. There's a lot of residual weakness, right? I said tick paralysis. These kids can be back to normal in 72 hours. So, like I said, I did a lot of research on this. I was super interested. One of the things that I learned is often with tick paralysis, you don't find the tick on the exam, but you find it on imaging. And so I decided to go back and look at the imaging and see if I could find anything. Because keep in mind, we had the head CT and the MRI done on day 1. So when she came in, and guys, I looked back and I looked at the MRI, and it will load, maybe. That is a tick on her scalp. That is the tick. So she did come in with the tick, which obviously I am very biased and think it's tick paralysis. And we all missed it until it was massive, and her grandma found it braiding her hair. So really interesting case, a lot of controversy in the hospital. I talked to providers that took care of her in the PQ. I talked to the infectious disease doctor. I talked to another like really outdoorsy doctor. It was, no, God, literally this guy goes on Sasquatch hunts it. When I tell you, he was in, yep, he was a very interesting doctor. So conclusion, the patient was stable and discharged, which is wonderful. Still don't really know her recovery status. I did ask my preceptor if I could call the family, but my preceptor wasn't down for me to do that, unfortunately. I personally think it was tick paralysis, but big takeaway here, if you have any patient present with ataxia, always check for ticks and always check the scalp. If you'll notice that this picture looks a lot like the picture I showed you guys. This is a case of a 6-year-old with an almost like identical presentation where they found the tick. So I thought that was really interesting. Yeah, here are my references. Like here, I just have a list that will load of a lot of the things I saw. We saw a lot of really crazy cases, a lot of really crazy pathologies. Did a lot of things I never want to do again. We had a 3-month-old die of SIDS. I did a rape kit on a 2-year-old. We did lots of rape kits, but on a 2-year-old, it's different, right? We saw a lot, and it was a really great experience, but obviously very hard. I also included some slides of things that we found. This is a brain tumor in a 4-year-old on his brain stem. Neurosurgery said they would not be able to take that out safely. This is an ischemic stroke in a 6-year-old. We have no idea how that happened, so that's crazy. I almost did my case on this. This was a 5-year-old. She had a right middle lobe pneumonia. They treated it twice. She was fine. She was active, like did not look sick at all, but she kept on having fevers. This is an effusion. This right here is her entire lung, squished up this tiny in her chest, as you can see. So that was crazy. Had to obviously put a tube in her. Some other things, we diagnosed SMA syndrome last week, superior mesenteric artery syndrome, really rare. Here's a testicular torsion, subarachnoid hemorrhage. This was really interesting too. We had a 6-month-old with a congenital diaphragmatic hernia, and his stomach was in his chest. They misdiagnosed it as pneumonia. You can see here there's no gastric bubble, but here they thought this was a pneumonia. It was actually his stomach in his chest. So just a lot of really crazy things. Here are the common cases I saw. Here's a lot of the breaks I saw. We had a kid 2 weeks ago with a skiffy, which you can see here. And then he came in 2 days ago and he fell on his crutches and broke his elbow. But sorry, I don't take up too much of your guys' time, but that was my rotation. So happy to answer any questions about the case or anything else. And if you guys want me to share this PowerPoint with you to see some of the stuff I saw, I'd be happy to, because I learned so much this rotation and I did so much, and it was a really wonderful experience. So.
Tick cause that?
No, there's only 5 ticks in the world that can cause it, and only the female ticks of those types of ticks can cause it. Yeah, so actually it's more common in Australia, very rare in the US. We actually had another physician, that outdoorsy guy, that when she came in, he told us, hey, check for ticks. Like, there's this thing called tick paralysis, and he had seen it once before. And so that's what even put that on our differential.
What kind of tick was it?
It was a type of dog tick. I forget the specific type, but they obviously did send it off, and it was obviously one of those 5 that can cause it.
Is it like the tick titers? I'm pretty sure we learned this in class earlier, last year, whatever. They were negative, right?
The tick titers were negative, yeah. So those were like for Lyme disease, Rocky Mountain spotted fever.
Yeah.
But she didn't present with it. Like, she had no fever, she wasn't sick. It's a very different thing. It's just from the neurotoxin that they release while feeding only the females.
Yeah,
So,
I was gonna ask if like that certain tick wasn't like picked up on the titer.
apparently not. Yeah, very interesting.
Weird.
Sophia.
I know you said you didn't know exactly how long it took for like the specifics of her recovery, but once the tick was removed, you know, like, did you do any research on like the neurotoxin, like half-life or anything like that, as to when that starts to taper off? When
Yes.
the symptoms would get better?
Exactly, yes. So once you remove it, it immediately starts going down. You usually start seeing some improvements within 24 hours, which, although the documentation wasn't great, once the tick was removed, she did go from the PICU to the floor in 1 day. So that makes me think she was doing well. She was intubated for, I believe it was 11 days. So, and she obviously had a feeding tube. So I think the reason it took her so long to get discharged is because they were kind of taking her off of those things. But yeah, within like 72 hours, it's almost completely cleared from their system. Usually, definitely no symptoms within a week from all the research I've done. A lot of the doctors that treated her, and they treated her with the plasmapheresis, were arguing that they think it was Guillain-Barré because she was improving with the plasmapheresis. My argument back to that, and when I talked to the infectious disease doctor, is number one, she did not improve with IVIG, and they're considered the same exact, to have the same exact results with treatment. And 2, there's not really any research showing if plasma exchange can help in tick paralysis, right? Because the treatment is to remove the tick. So it makes sense to me that if you're exchanging the plasma, you're kind of washing out some of the neurotoxins, so you would see some improvement doing that if it was tick paralysis.
And are there usually long-lasting effects with the neurotoxin? Or
No,
do most people
not
fall
at all.
over?
Like I said, 72 hours, they can be completely back to normal. It's only when it's circulating, and then you're done, you're back to normal. Yeah, which is why it would have been really nice to see what her recovery looked like and call the family and say, like, hey, is she back to normal? Is she still having last effects? That would be another really good information point to differentiate if it was Guillain-Barré or tick paralysis. Okay, so looks like we get our break now.